I guess you need to have clear in your mind what you want. So like we talk about having a discussion with the physiotherapist about really what you want to achieve. And sometimes people have back pain and it's not the pain that's worrying them for that particular episode. They actually want to know, how do I prevent a recurrence in the future? So having it clear in your mind, I'm seeing the physio tomorrow, what is it that I want to fix up? Do I want to fix this episode? Or do I want to get an exercise program that's going to make my back stronger and reduce my chances of getting back pain in the future? And so there's sort of different issues around that. If you need to return to sport, you will need to tell the physiotherapist about that, and also try and explain the nature of your job that you've got, because they will need to perhaps adjust what they do depending upon the type of activities you do at work, the vigour of those activities. I think the first point is that the physio will talk to you and try and put you into one of those categories. And presuming that they've ruled out the conditions that have to see a medical doctor, they would do, I guess, a different, ranges of treatment that are on offer. Sometimes they may just talk to you and say, look, I think it's going to settle pretty quickly. What I want you to do is to stay out of bed, use simple analgesics, try and gradually increase your physical activity and let you look after yourself. And other physiotherapists would offer different forms of treatment to help speed them along. And so there's different forms of, physical therapy, so manual therapies, exercise approaches that physiotherapists can do, and they can also be helpful. There are some things that are old-fashioned physiotherapy treatments which don't help back pain. So usually anything involving being connected to a machine doesn't work for low back pain. They're old-fashioned treatments we used to think they work. We now understand they don't work for low back pain. If you get to see a good GP, they'd do much the same as a physiotherapist, to be honest. So they would, again, assess you to see what sort of back pain you've got and then sort of map out what sorts of things you could do yourself. And they're a little bit different to the physio because they don't often do the treatments in the room, so they wouldn't prescribe an exercise program. If they think you fit into that category, they'd refer you to the community physio that they work with. So, there's really a complementary role between the community GP and the community physiotherapist. They would manage patients often in tandem.